Hello, this is Dr. Irvin Sahni with Spine Center of Texas, and I'd like to speak with you briefly about fracture care. Fractures occur all over the body, from very young to very old. In a child, we might see a both bone forearm fracture. In an elderly person, we might see a vertebral compression fracture, or a hip fracture, or a wrist fracture. Fractures all heal the same way. Fractures have cells inside them called osteoblasts, which build bone, B for blast, build bone, and osteoclasts, which are a cousin to the cells in our immune system called macrophages that are multinucleated and cut through the bone. Osteoclast C cut through bone, so they break the bone down. These cells are very important, and they are very important to bone healing. Bone healing occurs in 4 different phases. The initial phase being the inflammatory phase. And this is why some physicians will ask you not to take non-steroidal anti-inflammatories during this phase. It typically occurs somewhere between 17 to 21 days. And your body, its normal reaction to many injuries or trauma is inflammation. It sends fluid, sends cells, it causes swelling, and you get an inflammatory, a painful, hot area. That's actually normal, and it's a very important part of the healing, and you don't necessarily want to suppress that. The other phases of bone healing are not that important, and we might cover those in another video. But the point is, clinically, to realize that you may want to avoid Advil, naproxen. Some doctors don't believe this, by the way, but many do. And there are other alternatives, such as hydrocodone and Tylenol, tramadol, that don't affect the inflammatory phase, that you might want to take at least for just that first couple of weeks to 3 weeks after you have a fracture. Fractures can be surgical and non-surgical. Many children will have wrist fractures, and we can, in many cases, just simply do what's called a closed reduction, which means we use an x-ray camera and we put the bones back in place. We confirm this with an x-ray camera, and then we put either a cast or a splint to hold it in place until it heals. Very commonly, fractures will heal in about 6 weeks. In children, they probably heal a little bit faster than that. And in adults, they sometimes can heal a little bit more slowly. Some fractures very predictably heal, like a both bone forearm fracture. Some are very difficult to get to heal, like a calcaneal fracture or the heel bone, which can be a real disaster, can require a very extensive surgery to get the heel bone lined back up. Some bones have a very tenuous blood supply, such as in the scaphoid in the wrist, which the bone is almost completely covered by cartilage. It only has a few blood vessels that pierce into it. And so if your fracture results in a disruption of that blood vessel, it can cause what's called avascular necrosis. So for that reason, that type of fracture will often be casted for as long as 12 weeks, which is much longer than when we typically cast a fracture. So the fractures are different. Their treatment is different. It's important that you leave your splint or your cast in place while your fracture is healing. In some cases, we'll have to do what's called an open reduction versus a closed reduction, where we'll make an incision on your skin, physically look at the bones, and line them up. This often will happen with an ankle fracture. This will often happen with an elbow fracture. Again, if the fracture can be lined up appropriately and it can be maintained, the position can be maintained, then there oftentimes is no reason to open the skin. Another reason to open the skin in a wrist fracture is to get early range of motion. Many, many years ago, people would be put in body casts for back fractures for months, or they'd be put in leg casts or arm casts for months. What we've realized more recently is that this is very bad. This affects the motion of the joint around that fracture very adversely. In some cases, it can become actually impossible to get your full range of motion back after being casted for extended periods of time. This is why in many cases, in order to get an excellent reduction, that is line the bones up in a much more optimal fashion, as well as start early range of motion, in some cases we will do open reduction internal fixation, even when a closed reduction is still a reasonable option. This is very typical for a distal radius fracture. We could put many people in a cast for a distal radius fracture, but after being casted for 6 weeks, the bones sometimes fall out of place, especially if it's in the joint, and the articular surface of the joint surface is uneven, which can cause rapidly advancing arthritis and pain in the joint, and that's why it's very important to get those joint surfaces or articular surfaces lined up. But also important is that when I plate somebody's wrist, they're able to start early range of motion. Literally, they could start moving their wrist if they wanted to the day of the surgery. Usually it's too painful and they wait 2 or 3 days before they start moving their wrist. But the bottom line is, instead of being casted for 6 weeks, they're moving their wrist as early as 3 days after surgery. This cuts down the recovery time, increases their function, and typically will lead to a lot less loss of range of motion. Some fractures, especially surgically created fractures such as a spinal fusion, can be augmented with something called external bone stimulation. External bone stimulation is where we use either a magnetic frequency or an ultrasound frequency to stimulate the cells that I spoke of earlier to work harder or work faster. So by placing you in an external bone stimulator, say in a patient who's at risk, a patient with more than one level that's been fused, a patient that smokes cigarettes or uses any form of nicotine, whether it's in the form of chew or snuff or smoking or even nicotine gum, or someone who's diabetic, as diabetics also have difficulty with their cells being able to heal like a person who's not diabetic. An external bone stimulator can help ensure or at least increase the chance that there won't be what's called a non-union or a pseudoarthrosis, where the bones don't grow together and then the patient has to come back and have additional surgery because their bones essentially didn't heal. Many smokers don't want to hear how smoking can so adversely affect the healing of a fusion, the healing of a fracture, or just about anything else. Why is that? Because nicotine causes the arteries to constrict. It causes vasoconstriction, and it can decrease the blood flow to a fracture site by 40%. When your fracture is healing, it needs nutrition. It needs all the nutrients that are required for that bone to heal. And when you essentially cut the blood flow after that fracture, whether it's a surgically created fracture like a fusion, or it's a wrist fracture or a hip fracture, then you increase the chances of that fracture healing incompletely, poorly, or just taking longer to heal. So in conclusion, there are many different types of fractures. There are essentially 4 phases of healing, the inflammatory phase being the one that you can control by not taking anti-inflammatory medications. And when your doctor asks you to start early range of motion, start early range of motion. If your doctor asks you to stay in your splint, keep it clean and dry, keep it clean and dry. Every fracture treatment is a little bit different, and it's very important to listen to your doctor's recommendations so that you can have an optimal healing of your fracture, return to function, range of motion, and not have to have additional surgery or treatments for failing to comply with your doctor's recommendations.